Hey guys, Ms. Schumann here, Chapter 18. This is Oncology. Chapter 18 is in your TIMBY book, so just do the prep you for that. There's also an escape room for that, just to give you some little extra knowledge that goes over the learning objectives for the chapter. There's also a few chapters in your ATI book. I do have it summarized in Blackboard on a PowerPoint slide. You're welcome to review that if you like. But basically, all those disorders we have already been through in your message 1, 2, 3, and 4. So you already have had that knowledge with you. But for us to start with, cancer is an abnormal, unrelated cell proliferation. You can have benign, malignant, and then the cancer can also metastasize. Neoplasms are new growth abnormal tissue or tumors. And the tumors, they categorize them according to tissue type. So we have carcinomas, lipomas, leukemias, and sarcomas. So benign is not invasive or spreading. It can grow very large, but it grows at a very slow rate. And it can impact some vital organs. So depending on the location of the tumor and where it's at, depending on how fast the slow rate of growth, it can start to pressure or put pressure on an adjoining or an adjacent organ, so that way you can have some pain just from the benign tumor. When we talk about malignancy, that is an invasive, and it is very capable of spreading. The growth of a malignant tumor is uncontrolled. The malignancy alters the cell membranes. It also alters the fluid movement in and out of the cell, but it also creates tumor-specific antigens. But we'll talk about that later whenever we start talking about diagnostics. But you have tumor-specific antigens for certain types of malignancies. So when we say metastasis, metastasis is the spreading to adjacent tissues, and that can happen in these 3 different ways. It can occur from vessels that are adjacent to lymphatic vessels. It can go from one to the other, transport from blood to the lymph system, and it can be diffusion within the body cavity as well. Metastasis can also develop by a secondary tumor that spurs from the primary tumor as well. So that's another way to look at it. So etiology of cancer, it is the second leading cause of death in 1 in 2 men and 1 in 3 women develop cancer at some point. The most common cancer is lung cancer. For men, it's prostate, lung, and colon cancer, and for women, it's breast, lung, and colon cancer. So what are the contributing factors to development of cancer? Well, we have chemical agents, and that's going to be the effect of tobacco and nicotine, exposure to asbestos, pesticides, formaldehydes. Lots of times you see these type of cancers located in the lungs, the liver, and kidney, and this is due to the biotransformation. Then you have environmental. So environmental can be sunlight or radiation, pollutants, electromagnetic fields, and nuclear power plants. That's where you'll see your environmental contributing factors. So diet, foods high in fat or nitrates, alcohol, and obesity. These can all be factors for cancer. Then we also have viruses and bacteria. H. pylori that we see in the stomach, that can be a contributing factor. And the human papillomavirus can also be a contributing factor for your cancer as well. Now, some medications that people take for different disorders can weaken their immune system to the point that they become susceptible to developing cancer. And then others may even have an immune system that is defective, whether it's genetic or mutation or malignant cells. You can have a defective immune system, and that can be a precursor to cancer as well. So let's look at some complications. Well, complications can be once a person develops cancer or have that diagnosis of cancer, malnutrition can play a huge factor. So lots of times when they're receiving treatment, whether it's radiation or chemo, oral or IV, whatever type of treatment they're receiving, malnutrition is a vital component in that complication. So once you become malnourished, of course, that's going to weaken your immune system and cause you to develop some problems. So you want to make sure that you're offering some good nutrition, good nutritional supplements to your patient that has a diagnosis of cancer. Other complications, of course, constipation that can be due to some of the medication, as well as the gastric stasis and intestinal obstructions. That can all be a side effect of some of the medication, or the cancer itself can cause complications. So emergencies. A lot of the emergencies are going to depend on treatment, cancer type, cancer location, that kind of thing. So the syndrome of inappropriate antidiuretic hormone can occur. The patient can have hypercalcemia. That could be a result of some of the treatment as well. Superior vena cava syndrome. You can have hematological disorders, so a patient can develop anemia and also develop some DIC, because you can imagine if their platelets are being broken down and if their bone marrow is being affected and different medications that they're getting, you can see how that DIC could occur with your cancer. So there could be emergencies with your patient as well. So your signs and symptoms. Now this is going to vary, and it can almost be individualized from patient to patient. So some of the most common signs and symptoms that you may see would be unexplained weight loss. You know, that's one of those admission things we ask a patient when they're admitted to the hospital, have you had any weight loss or gain over the past, so many months? So unexplained weight loss, pain, fever, skin changes, and fatigue. These are some of the more common signs and symptoms that you will see with cancer. Now, I know that in your chapter 18, there is a table in there that has some other signs and symptoms that pretty much go along with the type of cancer or the location of the cancer that may be. So feel free to look over that as well. It's let me see if I can find that page number for you in chapter 18. Yes, it's a box on page 259, and it's called Possible Warning Signs of Specific Types of Cancer. And that just kind of gives you some general information that may be associated with a specific type of cancer. And some of these we have gone over in some of your past lectures and courses when we've gone over, you know, respiratory, or we've gone over bladder and kidney, or even breast. So some of these that you've already seen, but it's a box on page 259. Another thing is to just remember what it's called caution. So these are some things that an individual can look at, or you can teach your patients about. And C would be change in bowel or bladder habits. A would be an unhealing sore or an ulcer that does not heal. Unusual bleeding. Thickening of a lump. Indigestion. Obvious changes in the size of a wart or mole, and a nagging cough. So you can use the caution mnemonic to do some patient teaching whenever you're talking about cancer and their signs and symptoms. So prevention. So as we all know, prevention is a big deal. That's a key to a lot of our underlying disorders and disease processes is prevention. So let's look at education. Educational awareness, the warning signs of cancer, factors and risk factors that go along with cancer. So education is a big deal with that, just educating your patient about that. The importance of screening, having those cancer screening programs, following up with the mammograms, following up with your colonoscopies, those screening programs that are out there, those are preventative ways. Go and have that yearly physical exam. As much as we hate to do it, a yearly physical exam is just part of that prevention process that we all need to take part in. Emphasize and teach self-examination. This is for both the breast, skin, testicle areas. How do you teach the patient to do self-exams for these specific areas? And then, of course, avoiding those risk factors. Talk to your patient about modifying their diet, exercise, lose weight loss, get into a desired weight area, just anything to decrease those risk factors and help with that prevention of that cancer. So here's just an example of some of the screening processes that are out there: mammogram, pap test, colonoscopies, a digital rectal exam, fecal occult blood. These are just a few of the screening processes that are out there that you really need to encourage your patients to take part in and let it be part of their yearly physical that they go to. So how do we go about diagnostics? Well, we start with a really good family history, because we want to know if there is a family history of breast cancer, ovarian cancer. Is there any type of history that would set the patient up to have them more susceptible to have a cancer? So we want a really good, thorough history of cancer within the family. And then also you start with your physical exam. So remember, this is where your breast exam, prostate exam, testicle exam, skin exam, all these will come into play. Start to do your physical exam. Lab reports. So remember, I talked about earlier there were specific labs associated with certain cancers. So here you would look for those protein markers and look at those, where you would have your BRCA1 and 2, your genetic testing. You would start looking at those lab results. Next, you can do some X-ray imaging, CT, MRI, nuclear, ultrasound. All these you're looking for tumors. Fluoroscopy, you're looking for tumors and that kind of thing to see the location of a suspected cancer. So there's various ways to visualize that with X-rays. We want to do endoscopies, flexoidoscopies, upper and lower GI series, all of those bronchoscopies. We want to do these type of testing because we're looking for specific cancers. And then, of course, once they do these type of tests, when they do your endoscopies, we want to make sure we can get a biopsy as well. That biopsy, the frozen section, we're going to get cytology. We're going to get that sputum, or we're going to get that slice of that tumor. We're going to send that to the lab, and we're going to be able to get our diagnosis that way. So here's a lot of different ways to go about kind of localizing the area and how we're going to go about obtaining those biopsies or obtaining that material to send to the lab so we can have a further clarification of that disorder. So I'm not going to be testing you over staging and grading. However, it is very important that you are familiar with staging and grading. That way, whenever you're in the hospital or a question comes up on NCLEX, you kind of understand that. So know that with your staging, it starts with a stage 0. So this is cancer is in situ. So you have malignant cells and they're confined to that one area. So that is your stage 1. The cells are confined to that one area. Stage 2, 1 to 3, these are spread to the lymph nodes or organs. And then 5 is metastasized. So it's pretty easy to understand your staging process. So just know 1 would be your least or less complicated to your stage 5, which would be your more complicated or more aggressive cancer. Grading is somewhat the same way. So grading, it is divided into differentiated and undifferentiated. So your differentiated, I can't even say it, cells are closely resemble the tissue of the organ. You can read it. And then your undifferentiated are cells bear little resemblance to the tissue of origin. So you have your 2 grading methods here. And then again, just like the staging, it goes from 1 to 4. So the higher the number, the less cells there are. The less the cells resemble the tissue, the original tissue. Then treatment. So first, let's start with surgical treatment. So your surgical treatment is the primary method, and that's used a lot for diagnostic purposes. Staging and also treating is surgery. The tumor can be excised. It can be local or wide radical removal of the tumor. You can have debulking or cryoreductive surgery. So debulking or cryoreductive is actually what it means. It's just going to decrease the size of the tumor because it's not able to remove it. Another type of surgery would be, an example would be like a lumpectomy. That would be a salvage surgery. And then you also have your prophylactic or preventative surgeries, and that's because you have like some of that BRCA testing done, and you have a family history or a genetic disposition for breast cancer, and you opted to go ahead and have your bilateral mastectomy done. You can do that as a prophylactic or preventative measure. Surgery can also be palliative, so it can help relieve some discomfort. So you have a tumor that is located in an area that is pressing up against the vital organ, or it's causing the patient pain. Removing the tumor in that location can help relieve the pain, but the cancer may have already metastasized to another site or another organ, and so the cancer is not going to be removed, but the site that's got the pressure on it will be. So you could do, an example could be a paracentesis or a thoracentesis, where the patient has cancer, but they have all that pleural fluid, so they can go in and do a thoracentesis or a paracentesis and remove that fluid, give that patient some comfort so they have less pain and they're able to breathe. So that's a palliative treatment. You're just going to relieve the pain and make the patient more comfortable, but that's not going to rid the patient of the cancer. You can also do reconstructive or plastic surgery to correct any defects. You can do a Mons procedure, which is shaving off layers of skin. So someone with skin cancer, that may help, and then that way they can add the topical chemical on that skin area. Cryosurgery is also another option. So these are just several different types of surgery that can be done for your palliative or treatment process. Radiation. Radiation destroys the cells by breaking strands of DNA molecules and preventing the growth and division of the cancer. So you have external radiation, and that's where it's targeted on the tumor and the lymph nodes. So you may see a patient come into the hospital or into the clinic, and they'll have areas on their body where they have black marker or X spots, and that is because that's where their external radiation is being targeted whenever they are going in for their treatment. You can have internal radiation therapy, brachytherapy, and that could be that's implants, and that's intracavity implants or interstitial implants that can take place. That's your radiation for your internal. Then you can have systemic internal radiation, which would include iodine, and that can be administered orally, IV, or by a body cavity as well. So one thing about your radiation therapy is there are a lot of precautions that need to take place. Whenever the patient is receiving radiation therapy, the length of exposure that you as the nurse has with the patient needs to be limited. The patient will need to be in a private room. Always make sure there's some distance between you and the patient when they're receiving their radiation. Shielding or lead aprons occasionally, you may have to use that. Make sure that you use the proper PPE, gloves, shields, masks, whatever you need whenever you're handling the radiation. If you happen to dump some urine or feces, make sure that you're flushing the toilet at least twice, and that way it rids radiation from the water and in the room there. Have the patient avoid any type of kissing contact with their family members when they come in. The family also wants to make sure that they maintain a safe distance as well. So with your radiation, your side effects can vary just depending on the length of radiation, the type that they're receiving. So they can have alopecia, they can have stomatitis, anorexia, nausea, they can develop cystitis, pneumonitis. I've seen that lots of times with your lung cancer radiations. Pneumonitis is so common with that. Fatigue. Know that they can have a suppression in their bone marrow, so that's going to set them up for infection. They can also develop some leukopenia. They can also develop thrombocytopenia as well. And they can also have some fibrosis form as a result of that radiation. So with your chemotherapy treatments, chemotherapy treatments can be optimized to take care or eradicate the cancer while it decreases the adverse effects. So that's very important to reassure your patient that the chemotherapy can be kind of like individualized and personalized to their type of cancer. So like I said, it can be optimized to rid the cancer while at the same time decreasing those adverse effects. So reassure your patient that it's very individualized. So there are very different ways that chemotherapy is given. It's given IV, and lots of times that's through a PICC line or a Hickman catheter or some type of implanted vascular device. It can also be given oral, IM, subcu, topical, intrathecal, and intraperitoneal. So always make sure that you know what type of medication you're given. If you're given an oral dose of tamoxifen, you need to make sure that you're wearing gloves with that. If you're with childbearing age, you don't need to handle the tamoxifen. So just look at those types of make sure you know the medication you're given, make sure you know how to handle that medication. So whenever the patient comes in, if they're going to have that long-term chemotherapy treatment and they need to have an implanted device, do all your prep work necessary. Get your family history, get the history of the patient. Also make sure that you have all that lab work done. Make sure that you know the platelets and the H&H, that type of thing before the patient goes down to have their procedure. It's very important that you know how their bleeding times are before they go and have that surgery for that implanted device to receive their chemotherapy. So before the patient has their chemotherapy, if they come in on a regular basis, if you work at, you can always pre-medicate the patient with some antiemetics that need to be. Teach the patient to avoid any spicy or fatty foods because they may develop some stomatitis. And know that hair loss, alopecia, is not just the hair, their hair. They can also lose their eyebrows and their eyelashes at the same time. So that's going to be some teaching that you may need to go in detail with the patient about. Talk to them about, like I said, their dietary modifications, small frequent meals, increase their fluid intake. They need to really drink a lot of fluid throughout the day. Bottled water, have some bottled water readily available. Have the patient report any excessive weight loss or changes in level of consciousness or any paresthesia that they may feel as a result of their chemotherapy. Stem cell transplant. This is the replacement of bone marrow destroyed by cancer cells. So this is one method of another method of treatment. So know that this kind of sets the patient up for risk for infection because that bone marrow has been coming into play. And then you have your targeted therapies. And these could be your cancer vaccines like your HPV. It can be photodynamic therapy, gene therapy, many of targeted therapies for the cancer are coming around every day. There's so many new cancer treatments out there. It's just unbelievable. There's just so many cancer treatments out there that we have to stay on top of that, those treatments, and just reassure the patient that that there's so many different options out there, and that way we can give them hope that they can find something that they will feel comfortable with, and that the doctor will be sure to listen to their needs and prescribe the best chemotherapy or treatment plan for the patient. So when we talk about our nursing plan of care for the patients, we need to make sure that we are monitoring them for any type of fatigue. Know that they're going to have some dietary issues, encourage those calories when we can. They can combat dryness or metallic taste in their mouth with any sugar-free candy or gum. Like I said, make sure they have plenty of bottle of water to aid them, because they have so much that we really need to increase our fluid intake. Body imaging, like I said, would be an issue, especially if you have someone having a mastectomy or skin cancer removal, or they have hair loss. So be very empathetic or sympathetic with your patient when it comes to these type of things. That distorted body image is very common. You'll see that. Gently carry out your tasks to reduce any pain. Control that pain. Pain is a factor. Make sure that you are giving that pain medication and not being stingy with it. And keep the patient dry. Control any odors that may be in the room, and by all means maintain their dignity. So reaction to pain, you know, age, gender, culture plays a part in that. So just be mindful of that when you're treating your patient. Palliative care, there are various methods to reduce that, like we talked about. Surgery, just to remove or reduce a tumor. Surgery, chemotherapy, or radiation can help with that. Palliative care. Medications that are frequently used for your treatment: opioids, antidepressants, anticonvulsants, corticosteroids, muscle relaxants, topical anesthetics. These are all medications that can be used to help with the pain. Pain medication can give it in a variety, different type of methods. Administration can be oral, transdermal, rectal, intravenous, epidural, intrathecal, sublingual, buccal, topical. These are just the methods of giving the medication. And then here are just a variety of other interventions that can be used in conjunction with traditional therapy as well. TENS unit, relaxation, distraction, cold heat therapy, massage, vibration, acupuncture. Those are just other ways to help control the pain. Whenever you're administering the pain medication, just be sure and monitor the patient's vital signs as you normally would. Notice if there's any changes in their response to the pain medication. Always give them the antiemetics whenever they need to, whether it's before meals or with or after the pain medication, whatever you can do to give them some comfort. So this pretty much wraps it up with chapter 18. There's not a lot here. Be sure to do your prep U. I will have the slides that I used with the presentation link on Blackboard for that, so you're welcome to use that. If you have any questions, or if you would like to have a live lecture with this, please let me know and I'll be happy to arrange that. Thank you guys and have a nice day.